Okay, good afternoon, Dries. We're here in the Mark Macaulay lab of the Stanford University. You're already a couple of years working here on the behalf of our foundation. Can you tell us a bit more about all the work you do here?
Yeah, I'd be happy to. So I've been here for the last almost 3.5 years now, working on the PLN arginine 14 deletion mutation. I started here actually making patient lines. From Dutch patients.
So from material we shipped from the Netherlands to here, and
exactly.
You made the lines.
So we made lines. We use CRISPR-Cas9 to correct the mutation, and then we started to look more at what was going on inside of the cells. We used a technique called single cell RNA sequencing to look specifically what's going on in every individual cell, and what we noticed using this technology is that we had a signature of the unfolded protein response going on in these cardiomyocytes derived from patients. And this was kind of missing when you corrected the mutation. So we could directly tie it to the genetic defect of the arginine 14 deletion. What is the unfolded protein response? So if you think about a protein being made by a cell, it goes through a lot of different steps in order to mature and become a kind of an adult protein. So it's being synthesized, and then there's all these different proteins, chaperones, that help it fold. And that goes through quite a lot of phases. It comes out and it tries to fold it one way, it doesn't work, it tries to fold it another way, until it finally settles on its final, most energetically favorable structure. So that's how a normal protein gets synthesized and gets folded by the cell. However, in some cases, these proteins are unable to be folded, also called misfolded proteins. And in this case, the cell can get rid of it. So it has a few options on how to get rid of it. And usually the cell is able to deal with those because it happens all the time. So it's also under normal conditions. And it's able to just, get rid of these bad proteins. In certain cases, proteins can also aggregate. So they come out, they get synthesized, and they can't be cleared by a cell, and they start to clump on top of each other, and that's called protein aggregation. And that can lead to detrimental effects for the cell if it can accumulate a lot of bad toxic proteins outside the cell, which can lead to the cells dying. So that is a possible mechanism there. And the unfolded protein response is basically a response to proteins not being folded properly by the cell. It can sense unfolded proteins, and it can start basically signaling to the cell that something has to be done about it.
And that because of the mutation, there is something wrong with the protein, and because of that mistake in the protein, it cannot be folded the right way.
Exactly. So it cannot be folded the right way. The cell senses that there's a lot of unfolded proteins. That is, it has these sensors inside the cell that they will tell, hey, there's too many unfolded proteins inside of the endoplasmic reticulum, which is the organelle of the cell, which is folding the proteins. And that leads to a cascade. Basically, what the cell does, it tries to stop protein synthesis, and it increases a lot of these chaperones, so these proteins that help fold. So it increases the expression of these chaperones to try to restore the balance again. So basically, it halts synthesis, tries to refold everything that's going on inside the cell. So that's a way of trying to restore the balance of the proteins inside the cell. So that's basically the unfolded protein response is able to kind of mediate that effect.
And then you're trying to find a drug, a medicine, which helps to take out the stress of the cell and to help it fold, or
exactly. So what we noticed, so what we've been able to do in the lab is to study this unfolded protein pathway, and by knocking out, so getting rid of certain parts of it, we're able to see what is the impact of that on the contractility, how do these cardiomyocytes contract. And we concluded from this that it seems to play a protective role inside of these IPS cardiomyocytes, inside of these arginine 14 deletion cardiomyocytes, which is interesting. So basically, it's there as a protective mechanism for these cells. And that's very interesting. So that kind of ties it to the disease, because of course a lot of patients, as the disease progresses, that contractility suffers, and that maybe involves the unfolded protein response. So what we're trying to figure out here is, can we therapeutically, so can we target the unfolded protein response with small molecules or drugs? And we're trying to do this with different libraries that we have here in house, to see if we can basically make these cells better. So can we get these cells to contract better by
To
targeting?
feel healthy again.
They feel healthier,
And,
exactly.
yeah.
Yes.
Very impressive, Dries. And look, because you're seeing the first things who are starting to work. So
Yeah.
we will be following your work, and I hope to be back here in half a year's time, and then I hope to hear what the progress you're making.
I'll be happy. Yeah, it'd be great if you come out again, and happy to share our progress with you.
Yeah. So we'll be back.
Yeah.